Welcome, everybody. My name is Sherry Stoka, and I'm owner and founder of Weightless MD, and I've been doing a number of videos on continuous glucose monitoring. And for those of you who are familiar with that, that is essentially looking and managing your blood sugars 24 hours a day, 7 days a week. And the reason why I decided to start looking into my blood sugars is because of my metabolic health. You know, metabolic health is a really hot topic right now, and newer research shows that 88% of Americans have some type of metabolic dysfunction. So I thought it was really important for me to get some personal experience, really learn more about my lifestyle and how it aligned with my blood sugars, so that I could really bring this to other people and all of our patients. So I have been doing a number of videos. This is the 7th video. And rather than me just kind of talking directly to you about my experience, I really wanted to bring a whole different perspective to the table. And with me today is Erica Gutierrez, and she is a registered dietitian. She has been with me for really since the day that I opened at Weightless MD. And she has a really unique story. And I asked her if she would be willing to talk more about it and share her story. So here she is to really dig deeper into not only metabolic health, but diabetes and things that go along with blood sugar management. So Erica, thank you so much.
Yeah.
For being here.
I'm very excited to talk about this topic. I actually remember I was supposed to be coming into work and I had to call you and say, I think my daughter has type 1 diabetes. I need to take her in right now and figure out what's going on. So for the last 6 years, she has had type 1. We were actually on vacation and she would drink excessive water. I used to have to tell her to drink water. She never would drink enough. And every 30 minutes, we had to stop for a bathroom. And luckily, I knew the signs of what diabetes was. A lot of people wait way too long until they're in something called DKA and very sick. And it's often still misdiagnosed. So, and the interesting thing is I never wanted to get involved in diabetes in my dietitian career. And unfortunately, I had to become an expert in it. So the last 6 years, I have been living by our CGM. Marin, my daughter, who is now 15, she's had one on within a month of being diagnosed. That has been a life-changing experience for us. One, because I know she's not too high or too low blood sugar level wise. So whoever created the CGM, it's been absolutely amazing. And what the CGM has really allowed is to show how complex sugars are. I know I've talked to you so many times about, can you believe Marin's numbers that did this when this? So I'm going to talk a little bit about some of the experiences I've had with a CGM and how that's changed the way we take care of Marin's health.
Yeah, absolutely. And I think, again, just reinforcing the fact that managing and checking and knowing your blood sugars is foundational to human health. And I know you're going to talk a little bit more about what that can do to the body when it is out of range. But maybe talk just a little bit before you kind of dig into that other stuff, talk a little bit about type 1 versus type 2, because I'm talking metabolic health with none of those, right? Just more healthy people, and then type 1, and then we have the type 2 population as well.
Sure. So type 1 is an autoimmune disease, kind of like Hashimoto's or rheumatoid arthritis. It is your body's immune system getting off track and attacking the pancreas so that her pancreas no longer is producing insulin. I'll talk a little bit more about insulin later, but with a type 2, they start to become insulin resistant. So their pancreas is still producing insulin, but what happens is it is overcompensating. It's producing a ton of insulin, but insulin's job is to get blood or glucose into the cells, and it's not able to do that. The receptors are blunted, and you have all this blood sugar in the blood, and then you have the insulin floating around, a hormone as well, and you just have raised blood sugars and lots of insulin, which is very problematic for overall metabolic health. So
Absolutely.
yeah, type 2 is reversible. It's something that you can do with diet and lifestyle. Type 1, we have not figured it out yet. We will, I'm sure we will, but that's again an autoimmune disease where your pancreas completely is not working. Yeah.
Yeah, I know. And we can talk about this. I mean, we've been talking about this for years, because when you think of autoimmunity, you go to like the foundation, you know, the gut and things like that. And I mean, you've been on such a journey with Maren and her and learning about this disease that obviously, you know, you've come a long way with this and differentiating, because I feel like, you know, still people kind of have a hard time understanding that. So thanks for clarifying that piece of the autoimmune aspect. So talk a little bit more about some of those factors.
Well, it was really wonderful being able to pair up with your knowledge and with Wayless MD, because we have done probably every specialty test we offer at Wayless MD, because it's, you know, I'm trying to really understand what was going on in her body. So anybody that has autoimmune disease has gut issues. So, you know, we really worked on her gut health overall. Yeah, exactly. And one of the biggest things that made a difference in the amount of insulin Maren needed was looking at her inflammatory foods. So the MRT food sensitivity test, I would bring in the results to her endocrinologist and say, look, when she is on this plan, she needs half the amount of insulin as when she's eating those foods. I mean, that is unheard of. You don't reduce your insulin levels when you're a type 1 diabetic.
Yeah.
You just go up.
So taking a step back for people to like understand what you just said, because I also experienced some of the same thing with, you know, seeing blood sugar spikes on the foods that I was sensitive to. So when we eat foods, and we tell people all the time, when we eat certain foods that we don't do well with, we elicit an inflammatory and an immune response. So taking that a step further, now that's affecting your blood sugar because it's a stress on the body. So putting all those pieces together, yeah, it was so, because I remember when she did the test and then immediately removing those, the blood sugar started to come down and obviously normalize.
Mm-hmm. Well, and you touched on a piece before about just having your blood sugar number at fasting, you know, the typical blood work you do at the lab, that's not really going to show you your true risk for high blood sugars, insulin resistance. There are other tests you need to run. And even the A1C, that's a very well-known and what's done for all pre-diabetics and diabetics, that still does not give you a very accurate reading of what your blood sugars are, because A1C takes an average. So you could have very low, like lows all the time where you feel shaky, but then also have highs, and it's going to balance to the middle and say, oh, your blood sugars are fine. What we really want is time and range. And I know you've talked about that a bit, but you want to keep it to a very tight range where you're not going above and you're not going below. And that's when really your body's working metabolically the best.
Yeah, exactly. And I think it's important to maybe talk a little bit more about why that is so. What happens when we go out of range? Because the majority of people, again, I keep quoting this, 88% of people walking around have some type of metabolic dysfunction. Blood sugar management is a big piece to that. So nobody really, if we're not checking, we could be spiking all day long and not even knowing it. So can you talk a little bit more about what happens to our body when our blood sugars are out of range?
Sure. Well, the first thing, and what most people probably will notice, is the symptoms. So when you have high blood sugar, what ends up happening, your body will compensate and you crash. So, you know, that's the people that always say, I need sugar, I need to be eating every 2 hours. They definitely have some blood sugar dysregulation. But, you know, the things I noticed with my daughter, for example, is she gets a really bad headache. When you're over 300, you're not supposed to drive. You're so impaired it's like you're driving drunk. So your body is very way out of whack. So high levels. So this took me a lot of times hearing it. So I know this is complex, but I'm going to try to keep it as simple as possible. So insulin is a hormone. And what happens is when we eat carbohydrates or sugar, your body signals the pancreas to release some insulin. So insulin's floating in the blood, your glucose is in the blood. And what the insulin's supposed to do is take that sugar and move it into the cell. Our cells need that as a fuel source. So it's bringing it in there. When we have insulin resistance, that receptor does not see insulin. And all this insulin and all this glucose is running in your system still. So it has to go somewhere. And that's actually one of the reasons why frequent urination is one of the side effects, because that's one of your body's ways to flush out all of the extra glucose that's running around.
Because it's not getting into the cell, right? And it's got to get somewhere. Mm-hmm.
But insulin's a hormone. And when insulin is high, it's telling your body to store fat. So that is the next place. When the glucose cannot get into a cell, it goes to muscle, it goes to liver, and then it gets stored as fat. And so that's one of the reasons you see type 2 diabetic, oftentimes overweight. That's, we talk about weight being a symptom of your overall health. And that's one of the factors or one of the reasons.
Right.
Hopefully that made sense.
Yeah, definitely. And, again, because the concept, when you see like a visual of the insulin kind of connecting to the sugar molecules and, pulling it out of the blood, it's a lot easier to understand. But I think you hit the big point was about the fat storing aspect of it, because people with now diabetes, they have that metabolic dysfunction. That's why they have such a hard time losing weight now, because their body's not working normally, and so now it just presents that whole cascade of events that continues to happen.
And what happens as well, so the cell actually is starving. So you have hunger, your body's saying, I'm not being fed, even though you have really high blood sugar and you are eating. So it is definitely a missignaling, and your cell is actually starving.
Yes, the craving. So you're eating and eating and eating. You're not absorbing any of the nutrients. So you're like, why am I so starving and having cravings? Because your body is perceiving that of a starved state, which is huge.
And so next week, Thursday, you're going to have a webinar on cravings, the body's cry for help. So I really look forward to you going much more deeply into the dynamics of that, because I would say 90% of the patients that come in the door, that's one of their biggest struggles, is they have these cravings, and motivation only lasts so long. So we got to get down to the metabolic reason and help them.
Right. I know. And it's like one of the first things I'll say to somebody when they're like, it's my cravings. I crave sugar. I can't give it up. I can't get away from it. And my first response is always, cravings are not normal. We have to figure out why you're having those cravings. So yes, I will definitely be digging deeper into that for sure. But now, and what's just going through my head, because of certain conversations that I've had with other people, that have whether it's type 1 or type 2 diabetes, but managing their blood glucose. Talk about how blood sugar is affected by other things. Now, we're not just talking about food and, the carbs and the sugars. Blood sugar is affected by so much.
Yes. And I want to even take a step back further. And remember, insulin is a hormone. All of our hormones work in conjunction with each other. So ghrelin and leptin, which are our hunger signals, also are related to that. And then also our fat tissue has different types of signals. Someone that has a high visceral fat in the midsection has different hormone signaling than someone that is leaner. So it's very complex, but what I do want to dig into some of those other factors that are affecting blood sugar levels. So obviously the easiest one is the number of carbohydrates you're eating, and if they're complex or simple. So you could have something very simple carb, a candy or a soda, and it just will spike very quickly. Now, when you start to balance a complex carbohydrate like beans or quinoa or something like that with some healthy fat and protein, what it does is it slows down digestion. Your proteins are much harder to digest. So it's going to put it down into your system much more slowly. So it's just like a slow stream of energy versus a big amount all at once. So that'll just help, instead of going up, down, we just kind of have a nice little plateau. So now getting into some of the interesting things that I found by my daughter wearing the CGM, it was those inflammatory foods. Like I said, we needed double the amount of insulin. I'm a very analytical person. And when I was saying, oh, 12 carbs, here's how much insulin to give, and 12 carbs of something else, how much insulin to give. And it was never the same, not once. So then I started looking at all those other factors. So one of the big ones is exercise. Within like 12 to 24 hours after exercise, it affects your blood sugar level overall. So regular exercise is so important for management overall. And that's why that's one of the things that are recommended for diabetics.
Yeah. Have you noticed, because the type of exercise plays a huge role as well because of like the anaerobic versus the aerobic exercise. Have you noticed any difference there?
That's very interesting too. It does depend on sport that she does. It does depend on even like time of day. Swimmers have a really hard time. And then, you know, I was taught things like, oh, she should, if she's going low, she should do a quick sprint and it'll help it bring it back up a little bit. So there is a lot of science around the two types, the anaerobic and aerobic exercise. Yep. Also, so that's another piece, that's when she'd have a low at night. So it's utilizing the glucose stores from your muscles and your liver, and then it has to replenish those stores. So what happens is when we sleep at night, we're restoring our brain, we're restoring our body, and it will restore all those glucose stores within our body, and then it causes you to crash at nighttime.
Yeah, definitely. I do want to talk a little bit about stress and stress hormones, because again, the majority of people walking around are in a stress state. And, you know, we hear about it all the time, like when you're stressed, oh, that can cause weight gain. But I don't really think people truly understand what that really means. I don't know if you have noticed a difference in her levels when she's in a stress state, or do you want to talk a little bit about that?
I definitely have noticed a difference. Acute stress. So like if she has a presentation that day, she'll have unexplained high numbers that has nothing to correlate with food. But then I've also noticed on vacation, when she's very relaxed, how much less insulin she needs. She's a type A, so all during the school year, I think she's a little bit stressed out. But then to the sleep factor, remember, sleep is where we restore. There's other ways to do it with meditation, breathing, all that kind of stuff. But when we're not getting proper sleep, our body isn't able to fully recover. And that is considered a stress state for the body as well. So all of those factors, she had her first sleepover when she was pretty young, and she stayed up, you know, she probably slept 1 hour. And that whole next day, the whole day, we couldn't get her numbers under control.
Right. And that's where it becomes, you know, a little bit difficult. I mean, it becomes difficult because people want to focus so much. And it's even for someone like me managing my blood sugars. You know, it's not just about the food. You know, just because I had a certain food that spiked, or a meal that spiked my blood sugars, you know, I have to look at what was going on during, you know, in that day as well. So it's not like you know, it gives you an opportunity to really learn about yourself, but you can't just give up on any one food or one, you know, habit that you're doing, because it really, there's so many other things that could come into play. Another
really big one is the time for insulin to react. So I know for Marin, obviously it's different because we have to dose her the insulin and then she eats her food. But how this would relate to somebody that's not diabetic is eating slow, cooking the meal and smelling it and appreciating it. It's the whole mindfulness around eating that it gives your body the time to release the insulin from the pancreas. So when we just quickly eat, we're not even paying attention to it, it's not, your body's not able to catch up as fast and take care of it as well. So causing high blood sugar again.
Exactly. So what has been like some of your more, your strategies with your daughter? I mean, because you've learned so much. I mean, you are always trying different things. I mean, what would you say, what recommendations would you give to people that maybe are dealing with a child with type 1? And then on the flip side, something that maybe you've learned that may help other people.
Sure. So dig deeper and yourself and your child. Your child, knows better than anybody else how they're feeling and what's going on. So keep uncovering what is happening. Remember, this is an autoimmune disease. And if I didn't do all the things that I've done over the years, I'm sure she would have another autoimmune disease. You're 15% more likely as a type 1 if you have one autoimmune disease, you're 15% more likely to get a second one because you're not really getting to the root cause of what's happening. It often stems from leaky gut. So getting your gut checked is like number one. I really want to avoid Marin having celiac because she is very sensitive to wheat, and we mostly have it reduced or out of her diet. But if she had it one time, she might feel a little sick, but it's not going to be, where I can't have wheat in the house at all, for example. So it'd be looking much more deeply. I swear up and down on the MRT, the food sensitivity test, that has made a huge difference. She was having daily headaches, very irritable, more than, a normal teenage girl. Just quality of life was really tough for her. So again, getting deeper, figuring out why. And I never talked about this, but I think it stemmed from a virus. And I know viruses now have gotten a lot of exposure, but she had strep throat about a month before she was diagnosed. And I've talked to a lot of families, and I can't tell you how many have had a similar situation where it doesn't have to be strep throat, it could be any virus. Viruses are pretty nasty on the body, and that, I believe, catapulted her into the type 1.
Yeah, absolutely. So again, just kind of, I guess, you've shared such a side, in this whole blood glucose management part, that hopefully, anyone that listens to this, really understanding that the disease for type 1 obviously is complicated. It's much more than just trying to manage, 15 carbs, one unit of insulin. Like, it's so far beyond that. And then taking it a step further and looking at the type 2 people with diabetes, and really taking a step back and helping people understand that that is 100% reversible. I mean, some people out there will say, once you've kind of entered into that much metabolic dysfunction, it's so hard to come back. I mean, we've seen it over and over again. I mean, and fast. So that's why I decided again to really look a little bit deeper into this, because we run a weight loss and wellness business, and the patients that come to us have these issues. So if we can dig deeper into their health and get them to a place where, like you said, cravings. I'm doing a webinar on what is your body trying to tell you? And because it's the majority of people that are walking around, and a lot has to do with just mismanagement of their blood sugars. So let's talk just a little bit about our programs and how our programs help with really, I say it all the time, our programs are designed to get you in a metabolically healthier state. So do you want to talk about our semaglutide that we offer?
Yeah, that was definitely one piece. So what we would when we noticed that somebody had insulin resistance, before semaglutide, we would definitely, on our programs, they're lower carbohydrate, and that will help for people that are insulin resistant. We encourage fasting or intermittent fasting, and that helps with insulin resistance. But most recently, we started a program called semaglutide, and it helps. What we've noticed, it helps everybody, but it really helps the people that have insulin resistance. Because like we talked about, when you're insulin resistant, you're going to have a ton of insulin floating around in your bloodstream. And when it stays there, it's triggering to store fat. So the medication is really there to help enhance the insulin and get rid of the insulin resistance, essentially, so that the cells are no longer starving, you're not craving foods. And, there's that hunger component that I think is so huge for weight loss in general.
Yeah, proper signaling is finally starting to happen. People, and that's what we hear all the time. They can't even believe, that they're not having this ravenous hunger all throughout the day. So, I hear that all the time, and that obviously is a huge piece to it. We also have a number of different programs we refer to as like our signature weight loss. They are strategic weight loss, programs that are really designed to metabolically heal to get people in a healthier state. And we've launched a program called Metabolic Reset probably about 2 years ago now. And this is a group program, and we are offering this out to really anyone, wherever you are, because it is virtual. And like I said, it's called our Metabolic Reset. It starts September 12th. And this is, again, 4 weeks that literally will change your health, your health status. So I wanted to make sure and point that out, because we will put the link at the bottom of this video, and anyone that's interested in, joining us for that program, we would love to have you. And then we also have some other upcoming events. Erica, do you want to talk about that?
The webinar that you're going to be doing is next week, Thursday, the 8th at 5 o'clock. That's also there's going to be a link in here for that. I highly encourage everybody to look at it, to sign up, because I think what happens is we go to our doctor and, our fasting blood sugar is fine. But I really encourage you to learn a bit further. Hopefully today was at least a start to all that, because it becomes very complex, as hopefully you saw from today. I also have a link in there on the semaglutide program, so you can see a little bit more if that would be right for you. And of course, we do free consultations. So right on the website, you can also just schedule yourself for that. And it would be with one of our providers. So they'd be in good hands.
Yes, awesome. Well, again, like you said, I hope this was helpful for people. We're going to continue to post on this. It is really, really important. And I'm sure you and I will be doing another one to dig a little bit deeper. And well, thank you very much. And I think we'll wrap it up for now.
Sounds great. Thank you.
Great.